Okay, aloha everyone. We are Team Ho'okolo and we're very excited to be here to share our project with all of you. I'm Alex and I will be kicking us off. So let's take a quick look at our agenda. First, we're going to introduce you to the team as a whole, and then we will explore the problem that we identified, cover the solution we developed, introduce our users, provide an overview of the case lifecycle, and then walk you through a live demonstration of the user experiences before wrapping it all up. So let's go ahead and meet the team. I will go first. I'm Alex Foster, and I have 3 years experience using Salesforce from a user capacity. My experience includes lead, opportunity, reporting, and dashboard creation and management. While participating in the Hiapo program, I've greatly improved my reporting and dashboard creation and management skills, and I've really enjoyed learning to build Salesforce experience sites. I look forward to diving deeper and excelling in all those areas and more.
And my name is Evan Webb, and I am a certified Salesforce administrator thanks to the Purple Maya Hiapo program. Prior to working with Salesforce, I have been a licensed massage therapist where I work with individuals to reduce pain and relieve tension. Now I am interested in reducing pain and tension in business processes with Salesforce. I enjoy programming and am interested in pursuing a developer path within the Salesforce ecosystem.
Aloha kako, my name is Kihei Seong. I'm also a certified Salesforce admin, and through the Hiapo program, I've learned so much about Salesforce and the opportunities it provides. So mahalo to Purple Maya. I have an interest in working on configuration for user experience and automation, and I look forward to learning even more in the future.
Hi everyone, I'm Shani Yi. I am also a certified Salesforce administrator, and I've learned a whole lot working with the Hiapo program and my team on this project. I really enjoyed getting more comfortable with the Scrum Agile method and expanding customization and automation in our solution using tools like flows and our experience site and reports and dashboard.
Hi, I'm Frank. I thought I was signing up for the Space Force, but wound up in this class somehow. Now I'm a certified Salesforce admin, and I'm interested in automation, custom development, data analytics, and the potential for integration with other software platforms.
Thanks, guys. Now we'll explore the issue we felt needed to be addressed and the solution we developed. So the problem, COVID variant surges coupled with inadequately staffed contact tracing centers that use inefficient methods has led to a significant decrease in the timeliness of contacting new cases. Next, I'm going to cover the top 3 issues contributing to this problem. First, automation. Phone call is a primary form of communication to make the initial contact with newly infected people. The issue here is that this relies solely on manpower and increases the risk for missed connections, if not complete missed connections, second, accuracy. Contact tracers are working a substantial amount of overtime to compensate for staffing shortages during surges. This means fatigued workers are more likely to make mistakes, which leads to inaccurate data. And third, accountability. Infected individuals are being relied on to inform their close contacts. This presents several issues: low participation, no accountability, and 0 documentation. After reviewing these issues, we knew what needed to be done and we're up for the challenge. So the challenge: to automate the contact tracing process, allowing contact tracers to focus their manual efforts on non-responsive or complex cases while ensuring timely and accurate data collection. We dug in, started planning, and our solution was born. I'm proud to introduce Ho'okolo contact tracing. Our mission, our contact tracers and technology enable disease investigation, notification, monitoring, and support for COVID-19 patients and those exposed to help reduce the spread of the virus. I'm now going to provide you guys a high-level overview of our approach to solving each of the previously mentioned issues. Automation. We need to drastically reduce the dependency on manpower and improve timeliness of data collection. Accuracy, standardized data collection to ensure quality control for accurate data analysis. And accountability, increase participation rate through self-administered questionnaires while maintaining time sensitivity. I will now pass it off to Shay, who will introduce you to our users.
Great, thanks, Alex. So let's take a brief look at our user stories. Our lab technician, Pam Beasley, receives a positive COVID test from Mr. Dwight Schrute, and she will log the results and basic patient information into our system. Our patient Dwight will be automatically notified and have a chance to confirm or edit his information. And now Dwight is very distraught, but Hōʻike reminds him to keep his cool, and he lists his employer, Michael, and his close contact, Jim, so they'll be connected as well. And later on, we'll see how Angela, a contact tracer, can view everyone's data as it's stored in Salesforce and how to accurately and efficiently trace all of our users. And next, Evan will show us a little more of what Hōʻike can do.
Evan, you're on mute.
Sorry, everyone. So here we are looking at what happens with a positive case in our solutions lifecycle. After the lab has gotten a positive test result and notified the patient, the lab technician comes to our portal and submits the patient's contact information so that we can begin contact tracing the case. When our system receives the case, we immediately email the patient with resources for the person testing positive, like guidance about quarantine procedures, and a link to participate in the contact tracing interview through the web. In this interview, we gather information about the patient's employer and close contacts in order to reach out and inform those businesses and persons of possible exposure and their next steps. For the patient, we monitor their status by following up with check-ins at regular intervals and close the case when the patient reports that they have tested negative. For employers and close contacts, we send them resources and information about best practices and ask for their acknowledgement that they have received and reviewed these materials. Our system relates our close contact and employer cases with our original patient's case in order to use that data for later analysis. Our system cross-references persons entered into our system so that we can track multiple contact events with each person, avoiding duplicates. And now I'm going to turn it over to Kihei for a live demo of our solution.
Okay, so the first step in the process is case creation. After notifying the patient, the lab technician heads to our website homepage, which looks like this. As seen in the tabs at the top of the screen, it serves as a hub for lab technicians to log cases and provides resources for patients, employers, and close contacts, such as next steps and best practices after possible COVID exposure. The resources tab has links to knowledge articles that we've set up for public use and reference. Our lab technician, Pam, clicks on the Log New COVID Case tab and fills out the case creation form. Since our solution automates a lot of the contact tracing process, the externally facing aspect is viewed in easily completable forms. We've created screen flows that we embedded in experience pages to achieve this. Today, Mr. Dwight Schrute has tested positive for COVID, and Pam is filling out the form with the patient's basic information, like his full name, date of birth, date of positive COVID test, contact info, and home address. In address fields, users have the option to manually enter their full address or search for their exact address using Google Maps within the form. After Pam submits the form, a case is created in our org, and an email is automatically sent to the patient with a link to the next form to be filled out.
Sorry to interrupt, Evan. You're got split screen going. Can you make it so that your the email and everything, we can see your cut and paste notes? Awesome, thanks.
Okay, this is where Pam's work ends. The next step involves the patient. After Pam enters Dwight's info into our database, he receives an email in his inbox. This email notifies him of his case number and informs him of the information he will need to have on hand for collection. It also includes a link to the initial interview form. If Dwight does not complete this interview within 24 hours, his case gets escalated and a contact tracer will reach out to collect the required information. In the confirmation page, Dwight has the opportunity to confirm or correct his information. Dwight's information is correctly displayed on the screen, so he will confirm the info is correct. Next is the symptoms screen. Dwight enters his onset symptoms, provided in a list of checkboxes. Then he can enter his vaccination status and date. In this case, Dwight is not vaccinated, so he moves on to the next screen. This is where he fills out information for the primary contact at his place of employment. He has the option to add additional or no employers if necessary. Dwight is the assistant to the regional manager at Dunder Mifflin Paper Company. So he enters his boss, Michael Scott's contact information, along with the company name and address. After he clicks next, a child case is created that is related to the parent case of the patient. Next, Dwight enters the contact information for any close contacts he knows of within the past 48 hours. The CDC defines a close contact as someone you are within 6 feet of for a total of 15 minutes or more, regardless of whether the contact was wearing a mask. Here, Dwight enters his coworker Jim's information. He has the option to add multiple close contacts if necessary by clicking on the slider button at the top. Now each close contact submitted automatically shows up as a child case to Dwight's case. After this, Dwight receives follow-up emails every 5, 10, and 15 days, or until he can provide a negative COVID test. The state of Hawaii requires that persons who have tested positive for COVID self-isolate until they receive a negative test result. Once Dwight receives his negative test, he can click on the link and confirm that he is tested negative. Next, provides the date of his negative test and a copy or picture, which can be uploaded to the form shown here. Test results will be reviewed by a contact tracer so that the case can be closed. Now Shay will show us how Dwight's employer and close contacts get notified after he enters them into our database.
Thanks, Kihei. So once the patient form is submitted by Dwight and the data is securely stored, his employer is automatically notified via email. So you can see here that Michael, I guess today, has received an email from Ho'okolo with some information related to COVID in the workplace and a link towards the bottom of it to confirm his receipt. So let's click on that and it'll take us back to our site to fill out the form on behalf of Dunder Mifflin. The simple form asks Michael to confirm whether he received the email with the resources and whether or not he'd like a contact tracer to follow up with him, but he's kind of negligent. So let's just go with no for now. And then he clicks through and his answers are recorded and the employer child case that's related to Dwight's case is automatically closed for the tracer. So now let's take a look at the process for Dwight's office mate. Well, surprise, surprise, Jim has been in close proximity to Dwight and he reported him. So now that we see that as Jim opens his email, he'll also find he's got a similar one to Michael and informing him he's been identified and giving him some knowledge, articles and information with best practices. So Jim clicks on the link in his email to navigate to our form, which is essentially the same as the process that Michael just went through. So Jim will answer the same questions, but this time, let's see what happens when he clicks yes to have a contact tracer follow up with him. And when he goes through with this, Jim's case does not get automatically closed. And instead, he is asked whether he would like to fill out additional questions, his gender, date of birth, and he'll also complete any vaccination information. And then once he clicks through, his record is updated and his case is escalated to a queue specifically to reach out to close contacts. And all of this so far has been done through our Ho'okolo Digital Experiences site. And all these users may have no clue they're actually using Salesforce. But next, Evan will show us what the real Salesforce user, the contact tracer, will see.
Okay, thank you, Shayna. So here's what a contact tracer sees when they log in to track and advance cases in Salesforce. The contact tracer begins their work in our contact tracer console at the home page. This page provides a jumping off point for our contact tracer to see some metrics at a glance regarding cases and their movement through the system. This gives the contact tracer a sense of what to prioritize and what kind of cases need the most attention. Below this, our contact tracer can see lists of their open cases. Additionally, the contact tracer can view cases by their type and escalated cases, as well as recently closed cases. So this way, depending on the contact tracer's goals at the moment, they can easily access the most relevant case for their given task. So for example, if we see that the COVID diagnosis cases, which represent patients, are far outnumbering our other kinds of cases, we may want to focus our work there and can quickly access the oldest open patient cases here. But first, let's look at Dwight's case and see how it was represented in our system. So we'll refresh this to see the case we just entered. Since Dwight has completed both the initial interview and has reported a negative test, his case is closed. Under related cases, we can see that the employer and the close contact have a case that have been entered and related to Dwight's case. As Michael has already answered for Dunder Mifflin, his case is closed. However, for Jim, since he asked to be called, his case is at the stage of outreach needed. And the contact tracer can see his phone number and give him a call and use the knowledge articles that are available on the tab in the page to answer any questions Jim may have. But let's say that a case is open. So let's open up one of these cases where we haven't received a response yet. For an open case, the contact tracer is presented with relevant contact details, how long it's been since the interview has been sent, as well as some basic demographic information. Since the contact tracer sees that the case is open and hasn't been responded to yet, they can use the interview patient button to interview the patient over the phone, filling out the same form that was emailed, except this time there's a call script attached to make the contact tracing call easy breezy. Okay. Additionally, we have a dashboard. We have dashboards with reports that show more metrics about how cases are moving through our system and where stuck points might be, how many cases we have coming in per day, what kinds of cases we're creating, whether it's patients, their employers, or close contacts, as well as what stage they're in, and then response rate by the kind of case we have. And now I'm going to turn it over to Frank to wrap things up. Frank?
Thanks, Evan. So our BHAG, our big, hairy, audacious goal, was to automate away the need for human contact tracers. Maybe that's not so nice. Maybe they need jobs. But perhaps instead of firing them, forcing them to work endless amounts of overtime, let's just let them take a nap on the job from time to time. Make their lives a little easier. Everybody's stressed out these days. So as you saw, we configured Salesforce to automate the most time-consuming portion of the contact tracing process, calling and collecting information over the phone. We created new cases, which trigger emails that contain links to resources and custom interview forms. And to build the automation you saw, we leveraged the Experience Cloud. We designed custom flows and subflows, processes, email templates, and alerts. This helps focus limited contact tracer resources on the more challenging and non-responsive cases like Alex described. Interviews not completed within 24 hours per CDC recommendations are escalated automatically for the contact tracer to follow up via email or phone, and the links expire. We accomplish this through escalation rules, case queues, and custom logic inside of our flows. We built out our solution to capture data efficiently and accurately. We standardized data entry with screen flows embedded in Experience Cloud pages, custom data validation rules and flow logic. We force required data collection by defining required fields on objects and within the screen flows themselves. And we minimize case and contact duplication by designing custom record validation steps within the flows and configuring object duplicate rules. We developed a solution that encourages participation in the contact tracing process by making it more convenient for everyone involved. Instead of being put on the spot during a random phone call, I don't even know if anybody answers calls from random numbers anymore. Patients in close contacts have the time to collect required information in advance, and they're notified through the email what information they're going to be expected to provide to the contact tracer via the web interface. Individuals can complete their interviews when it's convenient for them and do it at their own pace. Hopefully this encourages participation and compliance, and ultimately increased participation in the contact tracing process will help keep our community healthy and safe. But what's the point of collecting all this data if we can't use it to answer the important questions? We could use the data to generate real-time metrics, as you saw, including statistics and trends. We did that through dashboards and reports, and those could be developed and customized quickly and stylishly. As new questions arise in the ever-changing COVID landscape, we could use analytics to identify opportunities for improvement. Perhaps we started to see the interview responses via the web form is lower than expected. We see our rates dropping, our response rate dropping. Maybe we could push a new marketing outreach campaign. And we set out to create an adaptable and scalable solution that could be easily modified for additional use cases. Additional data could be captured by expanding on the standard or creating new Salesforce forms, objects, record types, fields, pick lists, all of which we did for this demonstration. Public resources could be updated quickly and easily to improve education and outreach through the Experience Cloud site that you saw. And on the back end, we could even track engagement and measure ROI on that new marketing campaign to justify the spending. So, automation, accuracy, accountability, analysis, and scalability does not start with an A. Mahalo for your time.